Hello everyone, I'm Dr. Rajesh Jha, Senior Consultant in Pediatric Department of Apollo Hospital, Noida. Today I am here to discuss a very important topic that is on vaccination, and it's the I am going to discuss the more on the most important vaccines, and but the side effect is that it's the most neglected by the parents. So why it is this? So for that we have to know the immunization program of uh, current scenario that is in India. That is, there are two kind of immunization program which is run in India. Is like first one is national immunization program that is followed by government hospitals, and it is a traditional immunization program which has been since long time, and which have the primary vaccination. But recently they have introduced some new vaccination like pneumonia vaccine, Japanese encephalitis vaccines, but lot of vaccines are not included, and government is planning this in future to induct. The another immunization program that is guided by Indian Academy of Pediatrics, which is followed by the private hospitals, corporate hospitals, and the practitioners in the clinic. That includes majority of the vaccines, and but few hospitals in periphery and small towns, they have categorized the vaccination like some are in mandatory part and some are optional vaccines. So but nowadays in present scenario, all vaccines are important because the diseases are new diseases are coming and prevalent. So I will take one by one the vaccines which are very important in present scenario, but they are most neglected. So first will come on the flu vaccination. Flu is influenza infection that is caused by viral infections, influenza virus, and this is a highly contagious, communicable air disease by and spread by airborne pattern. Earlier, influenza vaccine happened to be after gap of 3 to 4 years, and it came into the pandemic form. But nowadays it is like endemic, and it is prevalent in the society and coming every season, even at the change of the seasons. The problem is this: if one child is affected, then the outbreak and spread is very rapid, and that can lead to the school absence or obstacle in outdoor activities, and that affects the children development. So that's why it's a very important vaccine. But because it's a costly and it is given every year, so parents generally neglect that. After one or two vaccination, they don't comply and don't follow up. So this vaccine is very important to prevent influenza, and this has to be given every year in India pre-monsoon, like from May to September. The another vaccine which I am going to discuss is meningococcal vaccines. This is a bacterial infection, is a very deadly infection, and it causes meningitis, that is a brain infection, and it affects the brain very severely. That impairs, that causes seizure activity, sometimes paralysis, and it decreases the intelligence level. So this is a very deadly, and sometimes is a severe in skin infections happens. But mostly parents don't comply because of the high cost, and it is a two doses, and generally at the 9 months, and the booster is 12 months. But some, if it is not given at this time, we can do it after 2 years also. But the high cost is the obstacle, and generally parents uh, don't comply because of the cost. In government hospital, these vaccines are not available, so parents think that these are not important. The third vaccination, which is I'm going to discuss, is human papilloma virus. This is the only vaccine which prevents cancer, and it prevents cancer, cervical cancer in the female, and genital warts in male also. So this vaccine is given at the age of 9 to 13 years, and these are two doses. But because most of the vaccines uh, ends around 4 to 6 years, and only the DPT and HPV vaccines are there at the age of 10 years, so most of the parents forgets for these vaccines, and if not counsel properly at the time of 4 to 6 years, they don't come for this vaccine. But these days, there are a lot of awareness is going by the company, by the practitioners, to vaccinate this to prevent, because cervical cancer is second or third most common cancer in the female groups. So if even if they forget it by 13 years, they can take the three doses after that also till 45 years of age. Some hospital could put this vaccination in the category of optional vaccines. So this is also the hindrance why the parents doesn't comply with this. The other few vaccines which I am going to discuss is like varicella vaccines, uh, typhoid vaccines, and hepatitis A vaccines. These vaccines are not included in national immunization program, so they are not available on in the government setup. And majority of the children's in rural areas and in small towns, they go by this national immunization program, so they children doesn't have these vaccinations. So we have to make aware that varicella is very important. This is also communicable airborne disease. If one child is affected, the whole class, whole school can be affected. So it is given at the age of 15 months, and the booster is as early as possible by 18 months. Earlier it was around, the booster was around 4 years, but now it is guidelines are coming to decrease this to 3 years, or even 18 months we can give the booster. Typhoid conjugate vaccine has to be given once in a lifetime, and that can be given earliest when the child starts taking water or liquid other than milk. Hepatitis A is very much prevalent these days in India in the adolescent group. So those who are not vaccinated are mostly having this disease. So two doses of hepatitis A is also important. So these are the vaccines which are most important, but because these are not included in national immunization program, and sometimes it is put into the optional category, so these are not followed properly by the parents. So we as a practitioner, as a pediatrician, we have to counsel that these vaccines are mandatory, has to be followed, has to be taken seriously to prevent the children from all the diseases. These are the all we want to discuss. Thank you.